welcome to the Corporate Services Committee for this Wednesday, April the 14th. I'd like to call this meeting to order and ask the clerk to conduct a roll call.
Thank you, Chair. Chair Bradley. Councillor Butters.
I'm here.
Councillor Campion.
Here.
Councillor Diodati.
I'm here.
Councillor Easton.
Present.
Councillor Edgar.
I'm here.
Councillor Furtick.
I'm here.
Councillor Foster.
Present.
Councillor Gale.
I'm here.
Councillor Height.
I'm here.
Councillor Yip. Councillor Redicott. Councillor Rigby.
I am here.
Councillor Whalen.
Present.
And I see Chair Bradley there. Thank you, Chair.
Thank you. Good morning, everybody. So what we're going to be doing is we're going to be starting with a presentation to begin with from Niagara Health, partnering together for future South Niagara Hospital. With that, I'll call on Mary Jane Johnson, Project Director of the Stakeholder Relations, Niagara Health, for the presentation respecting partnering together for the future South Niagara Hospital.
Excuse me, Chair, it's Redicott. I want to declare a conflict with respect to this. I have a daughter that does work for Niagara Health.
Thank you, Mayor Redicott. Okay, go ahead, Mary Jane.
Chair, I'm sorry. I guess I have to interrupt you too. I got to ask a question. Is Shaver on Niagara Health? Because my daughter's on that board. Do I have to declare a conflict? Shaver's not Niagara Health?
No, they're not.
Okay, thank you. No conflict. Thank you.
Okay, go ahead, Mary Jane.
Well, thank you very much for having us this morning. We're delighted to be here. For our presentation today, it will be led by Lynn Guerrero, President and Interim CEO, Dr. Johan Villian, our Chief of Staff, Angela Zangari, our Executive Vice President of Finance and Operations and the Executive Lead for the South Niagara Project, and Cliff Harvey, Chief Planning Officer for the South Niagara Hospital. So with that, I'm going to hand it over to Lynn.
Thanks so much, Mary Jane. And I'll echo Mary Jane's thanks. I really want to convey my thanks to the committee for taking the time this morning to speak with us about what for us is incredibly exciting, and I hope it is for you too, and much anticipated initiative. Before we begin, I just want to note that the presentation we're going to show you this morning is a condensed version of the one included in your agenda package. And we could talk about this initiative all day, as you can guess, but we're going to try to keep the presentation to 10 minutes. And then we are here for as long as you need to answer any questions, and we're happy to go into more detail if needed. So Niagara Health is taking a regional approach to the way we deliver care, and you'll know that from some of the history of the changes we've already made. A regional approach means building a better connected healthcare system centered around patients, families, and caregivers. This approach, which is, by the way, in alignment with provincial policy and direction right now, means enhancing partnerships with other healthcare providers across Niagara to strengthen local and integrated services in each community. So our vision calls for Niagara Health to centralize expert high acuity care, most appropriately delivered in hospitals, and expand access to local lower acuity healthcare services in communities across Niagara. Enhancing community-based services closer to home means less need for patients to travel to hospital sites for their services. Could you go to the next, Mary Jane? Thank you. So currently, Niagara Health has programs and services located at 5 sites, as you know, so Fort Erie, Niagara Falls, Port Colborne, St. Catharines, and Welland. We also have a growing network of community-based and virtual services. So our vision for the future calls for Niagara Health to centralize its programs and services to 3 large sites. Hospitals will provide services for those who need a higher or more acute level of care, while services provided in the community settings will provide care closer to home for residents whose needs do not require hospital visits or admissions. We'll be working with Mayors Redicott and Steele and the communities of Fort Erie and Port Colborne to determine the best mix of local community services after the new hospital site opens, and new ways to provide care through things like the Niagara Ontario Health Team and other initiatives to ensure the needs of those residents are met. So by bringing together multiple programs and services across 3 sites, we'll make it easier for residents to access the expert care they need, provide an overall better experience, and enable communities to be and stay healthy. We're developing 2 plans to support the programs and services at our Welland site, an interim plan to renovate the existing space, and a longer long-term plan to build a new site, which still requires approval from the Ministry of Health. You may know that we recently received a commitment of provincial funding for an expansion of additional long-term care beds for our long-term care home in Welland, bringing our total number of beds at that site to 128 once new construction is approved. In what we're going to call a newly designed safe space with the best infection prevention and control measures embedded into the design of that new home. Work already underway in planning the new site will assist us to identify the final proposed programs and services to be offered at the Welland site, but you'll see here a close to final list of those services on this slide. So this is exciting. We're really excited to show you an illustrative rendering. We're not promising it will look exactly like this of the new site. So it's for conceptual purposes at this point. It's subject to change, but it provides an idea of what it may look like. So we're proposing about 10 or 11 story building, so building up instead of out. It sits on approximately 50 acres of land, and the new hospital will be located at the corner of Bigger and Montrose Roads in South Niagara Falls. It will have a helipad for urgent services and transfers to and from the site, and we're proposing that a public transit hub be located there at the site. So you'll see here some of the things the new site will have. So 469 beds and approximately 1.2 million square feet. So the site is larger than our St. Catharines site. Every space is being designed with a seniors focus embedded into all aspects of the design. This is a very important concept for us. We don't have enough time in the 10 minutes, but we can certainly speak to more detail on this during question period if you want more information. We're also working towards this being the first WELL certified healthcare facility in Canada. WELL is an exciting and important initiative for the facility as it will improve the work-life experience and promote well-being for our staff and physicians who will be traveling from across Niagara to provide services at this site. So that's it from me. Thank you so much. And I'm going to pass it to Angela to continue the presentation. Angela, we can't hear you.
Oh, sorry. Thank you again, and I apologize for that. But so the slide in front of you shows the significant number of visits that we're planning for the South Niagara site. But really what I want to highlight right now is those areas in green. And as with the St. Catharines site, the new South Niagara site will have a number of new and expanded regional services. Those include centers of excellence for complex care, wellness and aging, stroke, and geriatric psychiatry. These regional programs have been identified by growth, utilization, and level of expertise needed. And this is similar to what we did for the Walker Family Cancer Center and Heart Investigation Unit in St. Catharines as well. We're also very proud to have a regional Indigenous Healing Center with a dedicated garden that was co-designed with members of our Indigenous community. Just important to note as well, like where do our Niagara residents go for their care? Almost 90% of Niagara residents come to the Niagara Health for care. The other 10% are those residents needing specialized surgery from Hamilton Health Sciences, children's specialty care from McMaster or Sick Kids, and those going to West Lincoln Memorial Hospital or Haldeman Moore Memorial in Dumbville. By 2026, all complex care beds for the region will be located either at South Niagara site or Hotel du Shaver, with the new hospital accounting for 66% of complex care beds within the region. The South Niagara site will primarily serve South Niagara residents with over 50% of Niagara's population. This includes Niagara Falls, Fort Erie, Port Colborne, Wainfleet, Welland, and Pelham. And again, the Centers of Excellence programs that I spoke to earlier are for all residents of Niagara. So in summary, the South Niagara South will mean 7,400 more senior wellness visits for the residents of Niagara, 156 more beds, 12 additional hemodialysis stations, more than 20,000 emergency visits regionally, and will provide 77% more capacity for mental health and addiction visits. And then some of the regional benefits of the future hospital. I'm not going to read them, they're in front of you. But I also do want to highlight that there will be multi-year economic spin-off benefits from the project of this size. As a comparison, the St. Catharines Hospital project created approximately 5,400 jobs, many of which were in the Niagara region. And at peak times when constructing the St. Catharines Hospital, we saw 1,000 workers on site at once, and 85% of them being local subcontractors. The new hospital allows us adequate space and infrastructure to accommodate new and emerging healthcare technologies and have the best state-of-the-art infection prevention control measures to keep our community and staff safe, especially now with what we're going through. So following is a summary of our regional local share commitments past and present, and what, based on and for the South Niagara site, what we're coming forward with. For the Niagara Health St. Catharines site, the project was about $750 million. Our local share at the time was $116 million, of which the region contributed $21 million for new regional services of cardiac, cancer, and mental health. The $21 million was based on square footage for those new regional services. For Hamilton Health Sciences, the West Lincoln Hospital site, their project being approximately $250 million, a $60 million total local share, and a recent commitment by the region of 21% or $12.8 million. For South Niagara, it's a $1 billion+ project. Our total local share, $212 million for 21% is $44.5 million from a regional perspective.
You're just over 10 minutes, so I'll give you about another 2 minutes to wrap up.
Okay, sure, no problem. This is just a summary of the local shares that we're requiring. The province is kicking in $900 million. We're using parking and retail of $80 to $90 million. Our foundation, 35 to 45. Municipal contributions, some already confirmed, 35 to 45. And again, the $44.5 million request. And I'm going to turn it over quickly to Dr. Villian to close.
Good morning to everybody. Thank you very much for this opportunity. I'll try and speak as fast as an infomercial. I'd like to impress upon you the importance of this facility within the context of the care that we are committed to provide. And it's significant. This is a purpose-built facility that will form the acute care hub to our full continuum of care in our strategy to look after older persons. As you all well know better than I do, this is a demographic that's growing day over day here and is very important to us. We've also learned through the course of this current pandemic the importance of infection prevention and control measures. And the fact that this facility is going to be a 100% single patient room facility positions us very well for the future, not only in managing potential future large pandemics as the current, but even on the day-to-day basis, managing MRSA and VRE and C. diff outbreaks. So an absolute essential role that it will play. Our continuing drive to establish, centers of excellence, and we're thinking about stroke and the older person in this facility in particular, requires expertise. And if you wish to attract expertise, this facility undoubtedly positions us very well, because you can imagine the greater the expertise, the smaller the pool, that we compete in with other facilities, and this will position us greatly. So I really appreciate the few seconds. We appreciate your time and the decision you have to make. Thank you for your support, especially over the last year. We highly appreciate that, and our teams appreciate that. And Councillor Redekop, your daughter is a key member of our teams. Thank you very much.
Okay, thank you very much. Any other final closing comments?
So we can open it up to questions now.
Okay, great. Thank you very much, Lynn. So with that, we do have some hands up. So we'll start with Councillor Diodati.
Thanks very much, Chair, and thank you to our NHS team. And I have to say, the NHS has come a million miles in the last decade, and it's so good and so refreshing to see. And I've seen many surveys done of residents, and always at the top of that list is their health. And obviously the hospitals play right into that. So I just want to say and comment on the leadership and how they've really, really come together. And especially, you really get to experience it during a pandemic, and you get to see what kind of team that we have at Niagara Health. So I just wanted to start by saying that. So thank you. And next, obviously, you can see the buy-in from the public when you've got the beautiful St. Catharines Hospital, which I did spend a fair bit of time there a couple of years ago. And I can tell you from the inside out, as a customer or a client, it really does make a difference in your treatment and in your healing and the attitude of all the experts that work there, because you definitely draw different type of people, and they love to work here in Niagara. It's funny, I talked to and got to know many doctors from all over, and they said, wow, Niagara is unbelievable. They're telling me about it. So they're doing the commercials. So thank you, Dr. Villagen, for your infomercial. I think everybody out there has learned the jingle, the Niagara jingle. But to my question, Mr. Chair, I just wondered if, because we had a lot of dialogue around the local contribution, if we could just get a little bit of clarification into the planning and the commitment behind the St. Catharines Hospital and the regional share, because there was a lot of debate, a lot of discussion, and I just wondered if we can get a little bit of clarification, because obviously there's going to be some new commitments going forward with more better healthcare in Niagara, and I think we just need to kind of deal with the elephant in the room. So if maybe we can get some clarification into the planning and the commitment behind the St. Catharines Hospital's regional share.
Councillor Diodati, is that aimed to the presenters?
To the presenters, yeah, yes,
okay.
Please.
Thank you.
Thanks for that question. I'll ask Angela to answer that.
Yeah, thanks. Thanks for the question. And yes, I'm happy to answer that. So for the St. Catharines site, when we came to Regional Council at the time, it was based on the ask for new regional services that were brought to the region, specifically for cancer, HIU, so our heart investigation unit, and mental health. And the local share was developed based on the square footage required specifically for those programs. For the St. Catharines site, for those of you that have been there, I'm sure most of you have, the whole wing for the cancer center, on the second floor is our HIU, and at the back of the building is our mental health unit. We actually calculated the percentage for those new regional services, and we took that as a percentage of the total build, and that's how we came up with $21 million for the region at the time. So it was based on a percentage for regional services. Does that answer your question?
It does. It does. Thanks very much, Angela.
No problem.
Thank you, Councillor Diodati. Councillor Gale.
Thank you, Chair. And through to Lynn, right off the bat, thank you for the compliments we've been receiving about the vaccination clinics and the operation of them. It's nice not to get anything negative, just the professionalism has been wonderful at all the clinics. But my question to you on what you said was that you mentioned about community-based services in Fort Erie and Port Colborne, and this is prior to consolidating services. Could you explain that?
Sure. I think what we'd like to do, and what I've already started speaking to the mayors about this, is looking at given the 2026, late 2026, early 2027 timing with respect to the new hospital, what work do we need to do right away up until then to make sure that we acknowledge what services are required in those communities to best serve the residents at the point in time where the new hospital opens. And so a lot of what we see being provided at those sites right now, number one is complex continuing care, which we will have those beds consolidated within the new site. And we have urgent care centers, which for the most part, most of the issues, if not all of the issues dealt with at urgent care centers could be dealt with in primary care if primary care services were fulsome, accessible, there when you need them within the, within 24 hours instead of saying, well, we can see you in 3 days. So looking at what is the best way to deliver primary care in those communities that is interprofessional, not just physician-based. So multidisciplinary care that's available and appropriate and delivered how patients want it to be delivered. So sometimes in person, sometimes virtually, over the phone, via video, whatever that means, with a shared health record so that everyone has access to the health information they need on that particular patient at a point in time that it's needed. So that's one thing that we would like to talk to the community about. The second is great access to diagnostics. So looking at, should we have more community-based radiology clinics? So think X-ray, CT, ultrasound, for example. And how will we make sure that that's another reason why people end up in the emerge, right? Because they know that they can get diagnostics immediately instead of going to their family doctor. And the third thing I would say is that right now in those areas, we have specialists providing consultation services at those sites, let's say a day a month, a day a week, or whatever the needs of the community are. I would like to see that continue. I'm not sure about how the space will work and how those sites will be used going forward, but for sure bringing consultation and specialist services to the communities instead of having patients having to go to hospitals, I think is where we would prefer to see things go. And if I was a resident, I would certainly prefer that instead of having to go to the hospital just to see a physician for an outpatient appointment. So those are some examples, but we really want to talk to the communities and make sure that we're meeting the needs of the people who live there, which, we have some time to do over the coming years, and then speak to the ministry about things like getting family health teams approved for those areas so that we can see multidisciplinary primary care.
Boy, Lynn, I'm impressed. You didn't know I was going to ask that question and you answered it head on. I expected you to defer that. I'm done, Chair. I'm impressed. Thank you.
Thank you, Councillor Gale. Councillor Easton.
My mouse and I are having a little fight. Thank you very much, Mr. Chairman. This is a very interesting question that Councillor Gale has answered. I can tell you that when the consultations were in play for the local share, the regional's local share in regard to West Lincoln Hospital, this is exactly the model that we were thinking about in terms of, I think it's referred to as hub and spoke, but in fact, it's all about corridors and where do you need to have care provided and where will care be provided. So thank you very much, Lynn, for reinforcing that, because on that basis alone, this is the reason for the region to support the request here. And so there are so many things that I like about what I'm hearing, and I'm very sensitive to this because we have been through this in West Niagara. Your focus on older persons and the stroke. I'm curious to know how that fits into end-of-life care, because I don't see that anywhere in the model. How do you see that working?
I'll ask Johan to answer that.
Take that. We see whatever we do as a continuum of care. So it's not, we're trying to sort of get away from the fragmentation of care. So our palliative services are certainly integrated in our overall strategy when we're looking at particularly the older person. In its mature form, what we would like the patient to feel and experience and the family to see is that when you enter through our doors in the emergency department and through your journey as an inpatient in the acute care wing, through to your discharge home with supports, etc., that you see that there is a dedicated and a purposeful plan in your care. And we will incorporate all elements into that. And palliative care is just one of those. So we are very actively building on that strategy so that this is something that happens not by default, but by design. So yes, palliative care and end-of-life care, certainly a big part of our planning.
And doctor, do you see the continuum of care being delivered by Niagara, the Niagara Health System, or do you see a collaboration with already existing palliative services?
There has to be a collaboration. We cannot own all of this on ourselves. And while we are in this design process, we are actively reaching out to the community and all the agencies within the community. And this is where the health team concept can come to fruition. And we would absolutely need that to work very well for this to be successful, because the ultimate aim is can we provide care, as Lynn has articulated very well, when the patient needs it and where the patient needs it. And let's face it, not being young myself, all of us would look forward to the opportunity to receive the care in our home if at all possible. So yes, you're right. This is a collaborative model, absolutely.
Okay, that's very helpful. I have a technical question about the infection control features that you put in place, and I'm just bringing this up because I think yesterday at Public Health, there was also a discussion about long-term care. So 100% single patient rooms, I certainly understand that that's the gold standard. But what do you do about more common areas like team centers? How are those managed in this kind of an environment where you're really trying to separate and keep people safe?
So
direct that to.
That's fine. I can kick off, and I'm sure Cliff could probably help us with the more technical design aspects. Of course, the single room care makes isolation much easier. And listening to Cliff during the design meetings, a lot of what we are learning currently as a lived experience is going to be translated. And Cliff, maybe you could help us with the physical plant benefits.
Yes, for sure. Thank you for the question. Actually, Ontario actually benefited from SARS back in 2003. And I say that because I was at the Ministry of Health at the time. So a lot of things that we've learned have been built into the system. But one thing that we are doing is that we're actually doing what I would say is a mock pandemic plan on the new facility, so that we can actually do what we've learned from St. Catharines and other hospitals about social distancing, pandemic supply, isolation. So we were actually running through the facility today, the design that we have, as if we were going to run it during a pandemic. And that's actually taught us a lot about making sure we have one-way flow for patients. And I think one of the big lessons learned is that we try to isolate what is ambulatory from acute, so that we can continue to provide those ambulatory services, which are key to the community, while we're still dealing with a pandemic and the acute side of the hospital. So isolation, separation is a key element in the design today.
And thank you very much. That's very helpful. And obviously those standards would prevail regardless of the care setting. Is that an assumption that I could make then?
In terms of the design, yes. So every space that we're looking at renovating or building new are taking all those into consideration.
And that would be the same for everyone would use those standards. We should expect that those standards are being applied across the board.
Yes. In fact, I'll just note that we are in collaboration with other hospitals that are in the design process, sharing information and applying the similar standards.
Right. Thank you very much. Thank you, Mr. Chairman.
Thank you, Councillor East and Councillor Butters.
Thank you, Chair Foster. Thank you to the presenters for this one. So I have several questions to whoever can answer. First off is, seems that there's often been vague reference to Port Colborne and and Fort Erie Site Hospital. So I'm kind of glad to hear that there's a little bit more defined ideas coming forward than in the past. My questions with that is how will other shareholders be included in the gathering of information and what's needed? And I'm thinking about possibly like Bridges Community Health Center, the Newport Center, Northland Point that is attached to the hospital. So if someone could answer that question.
So I'll start and anyone can jump in as well. So we're hoping that what we'll call a broad consultation and information gathering to make sure that the community is involved is driven by the community. So we see ourselves as a support and being a part of that, but not driving it because of course the communities know best who to pull in. So for sure, what is going to be critical is pulling in those other care providers and service providers in those communities to work with us, because most of the care that will be necessary and actually wanted by those communities is not going to be hospital based. It's going to be community based services, right? So it's critical to involve those people. And we're hoping that these consultations can be driven by the communities themselves so that they can decide who's most important to bring to the table. Not sure, Angela or Mary Jane, if you have anything further on that.
I was actually going to turn it over to Mary Jane because I know, Mary Jane, you've been involved in a number of recent health services committees as well. So maybe you can just speak to that.
Absolutely, thank you. So currently, right now, we're in the process of creating a very detailed communication engagement plan for both of those communities. Again, to Lynn and Angela's point, focusing on the communities and asking the communities who best are our stakeholders to connect with, and using the partnerships of the Niagara Ontario Health Team to do that. So that's in the process right now and should be forthcoming actually in the next couple of months.
Okay, so your timetable to begin that process is in the next couple months to actually kind of boots on the ground kind of thing?
Yeah, so boots on the ground. So if I would say from a public perspective, you should probably see us very publicly forthcoming very soon.
Okay, that's great. So my next question is, what's the timetable where the region needs to commit funds?
So I think I can take that. So in the past, I'm just going back to like with the St. Catharines site, we would require funds starting at substantial completion. So in 26, end of 26 is my guess. I'm looking at Cliff to correct me if I'm wrong, but right now that's the plan. And the commitment can be made, so the $44 million can be made over 15 at once or over 15 up to 30 years. That's similar to what was done in the past. So for St. Catharines, the municipalities of Thorold and St. Catharines and the region contributed. And each took a different type of an approach, some starting with 30 years and then changing it, say, to 15 years, some over a 20, 25-year period. But it's not something that we're expecting on substantial completion. It's over a course of time.
Okay, but when does the commitment itself need to be made?
In 26 would start the commitment, and then
no, I meant like for you to go to the ministry with like the plan.
Oh, okay, the actual commitment.
Yes, we have XYZ on board.
Yes, so we're actually in our RFP stage. So within the next, I'd say 2 months, probably is when we would need that actual commitment.
Okay, and my last question, no, second to last question, pardon me. So I heard you say that the complex care beds being consolidated from Port Colborne and Fort Erie. And so I guess my question is, like, right now there's folks that are in, say, Port Colborne Hospital that are unable to get into a long-term care home. So do those beds stay there for that use or not?
The beds will stay open until we move to the South Niagara site, and then also there will be complex care beds at the Welland site remaining. There's 30 planned right now. Not to say that number wouldn't increase, but right now there's still 30 beds planned in Welland. So no residents would have to move. We're talking 26, 27 until that needs to happen.
I see. And so I guess this will be my last question. So in terms of it says in the presentation that P3 cost of financing is excluded at this time, does that mean it will be added later or not at all?
Yes, it will be added, but it won't be it won't add to our local share. We have that. That's not an ask that will be covered as well. It's
Okay,
just
thank you
the cost that gets added after once the RFP is released and awarded.
Okay, so it will not be added to the local share?
No.
Okay, thank you very much. Good job.
Thank you,
Thank you.
Councillor Butters. Councillor Campion, you did have your hand up. Did you wish to ask a question or you wish to pass?
Yeah, I took my hand down because the question has been asked and answered. Thank you.
Okay, thank you very much, sir. Councillor Whalen.
Thank you, Mr. Chair, and thank you to presenters. You've got some exciting times coming ahead in the NHS. Just a couple of questions about the building. As far as the 269 beds, is that an increase or is it pretty well status quo what we've got available in the 3 hospitals now? Can you answer that for me?
Go ahead, either Cliff or Angela. It's an increase, right?
So I can answer that question. Yeah, it's a 150 bed increase, of which a substantial number of that is medical surgical beds.
Some great news. Thank you. And just with respect to the number of visits, did you take into consideration the Pelham and Thorold? Because you hope you appreciate that we're closer to this new hospital than we are to the existing one. So I'm sure many people from our areas will be heading your way as opposed to going to St. Catharines as they do present. Was that the idea when you in those 91,000 visits? Or?
We did assume some of that. So I'm a Thorold resident. So I know this is something I bring up. So I'm right in the middle. Like for me, it would be same distance to go to the new South Niagara site or, continue to go to St. Catharines, but certainly some of my fellow Thoroldites would be closer. So we did have some assumption in there for Thorold as well, but certainly the site can accommodate any future growth as well.
Much appreciated. Thanks for looking after us, Angela. Thank you.
I see no others on the list, but I do have a question, I guess through to you, Lynn, and it's Chair Foster here. So this is an exciting project that's being laid out, and I'm supportive as it's going on. The one thing about this hospital that's a little bit different than some that have been built before is that it isn't just Niagara. This is actually a hospital that I would say that has some provincial significance when it's all said and done. The programs that you're looking at and where you're going with this. I had a discussion back a little while ago with Barry Wright over at the Canada Games Group. I'm on that committee as well. And he was mentioning that there's some significant partnerships that are coming into play with this hospital, with various universities, et cetera, as this is all shaping itself out. So I'm just curious if you have approached the province basically saying, the funding model, given the significance of this hospital, might not be quite right. Has there been any discussions going on from that aspect?
So it's a great point, and thank you for recognizing that we're hoping that this site does have provincial significance. I think it will with respect to learners. You mentioned some universities as well, state-of-the-art education that we kind of have a vision to not just be for healthcare workers, but for learners like high schools and having simulations and think of what technology can now allow us to do with respect to education. So we're really hoping that we have a nice footprint that is quite a bit different than other healthcare facilities. With respect to your question on different ways of funding, we've not entertained that with the ministry at this time. We would like to get over some hurdles with respect to our local share and the provincial share at being 90%. That's a hurdle, and getting through the RFQ and RFP phase. We have to get our foundation and the hospital working towards the fundraising part of that as well. We have put the ministry on notice with any other hospital partner who's also building right now, the fact that the pandemic will have some type of implication, we believe, on communities' ability to raise money. So we have raised that. We're not the only ones who've raised it. So the ministry is well aware that meeting targets that are set by the foundations might be difficult, and they've been put on notice. I would say getting the ministry's attention right now on anything other than COVID is very difficult. So we will have to choose our time very carefully if we're going to ask the ministry to pay attention to certain things with respect to new builds and construction. But we will do that at the time that is necessary. And if there are specific partnerships that will make this hospital unique as the planning continues, we would be going to the ministry for new programmatic funding. So for example, if we were going to build a certain educational institute, we would probably go and ask them for money to run that institute, for example. So all things are on the table with respect to innovative ways of doing funding. I just think we have to pick our time and get over a few hurdles, the least of which is the pandemic, before we have serious conversations about that.
Okay, thank you very much. I appreciate that answer. Any final comments, Lynn, at this point?
Maybe the only thing I'd like to say is when we talk about timing, so one thing we did at the very beginning of the pandemic, and I am so thankful for the team that is running this project, is we decided to protect the team running this project, to not put them as door screeners, not put them into the assessment centers. As you know, we run all the assessment centers for Niagara. They're not running in the vaccine, they're not vaccinating people. So we have protected this team to make sure we don't lose any time on this critical build for Niagara. So the team has not missed a single milestone, which is tremendous. I would say as we go forward with community consultations with respect to, let's say, Fort Erie and Port Colborne, we are going to continue those, and we're going to start them as soon as we can. We just have to be mindful of people's time getting through the remainder of the pandemic, number one. And number two, a lot of that's going to, the community consultation is one thing, but getting the ministry's attention on certain things, like if they were interested in funding a new family health team for one or both of those communities, getting their attention on things is difficult right now. So timing how this happens over the next little while will be careful and well timed. So I know we just told you, yep, boots on the ground, community consultations, and we are committed to that, but it might look a little bit different as we sort of get through the rest of the pandemic and tee up the ministry to be a little more interested in what we're doing with our old sites, because don't forget there's 2 big pieces of property and 2 buildings there that we have to speak to the mayors about, and then the services that will go into those communities. And just lastly, to say thank you so much for the time this morning. We've really enjoyed presenting to you.
Great, thank you very much. With that, we will move on to items for consideration this morning. From hospitals to tile drainage. So our first item for consideration this morning is CSD 18-2021, and it's the authorization of tile drainage loans. I'd like to ask Councillor Easton to move and Councillor Edgar to second that. Are you okay with that? Any discussion on this particular item? Seeing none, we shall be voting electronically, so please use your electronic vote, yes or no. And that is carried. Second report this morning is CSD 22-2021, Program Review and Options for 2021-2022 Insurance Renewal. I'd like to ask Councillor Butters to move that, and Councillor Furtick to second that. And with that, I'm going to turn it over to Todd for a couple of comments.
Thank you, Chair. And as committee recalls, last year was the end of our agreement with Marsh, and we had come to committee about this time with a plan to go out for a competitive bid process for the insurance renewal program. You may recall that we had difficulties in receiving compliant bids, and in fact we had to go back and negotiate with our current provider, Marsh. And the reasons for that we outlined a number of different times. It was a very hard insurance market that was caused by a reduced number of competitors in the market, and also the COVID complicated things later in the year, as well as some of the underlying items that are in the municipal sector. At the time, we had requested that we would get a one-year contract extension with Marsh, which we did, and we would come back in the spring, which we are here now, to indicate what our next steps would be. Based on our information of what the conditions of the marketplace is, it's actually probably, if not, it's not any better, it's probably worse than it was last year. And also some of the underlying items that we've identified that we need to do, we are recommending a one-year extension of the contract because we do not feel going out for a competitive engagement is going to reap the rewards that potentially you could see from this, because the marketplace is in a real difficult challenge. And we are asking, and we also indicate that our working with Marsh, who is our current provider, we could get more favorable opportunities by working with them as opposed, because there are some limitations with regards to once you go for a competitive market as to what the provider can do. So in this particular case, we're asking for a one-year extension. There's some items that I want to do, actuarial work, some valuations on our properties, as well as to really look at our program and then come back. So we're asking for the authorization to negotiate with Marsh on a one-year contract. That's it, Chair.
Thank you, Commissioner. Let us go to Councillor Gale.
Thank you, Chair, and I agree totally with what Todd just said. It's a horror story out there for all business and that to try and get insurance, and I agree with this. But I'd just like to have the first paragraph in financial considerations on page 2 explain to me a bit. It says the negotiated amount is 1.8 million. We were paying 900,000. Is that the extension for 1 year is 1.8, or is that what they came back at that was the horror story and we're getting a lesser amount for the negotiated, Todd?
So the $900,000 was what our premium was the previous year. The $1.8 million is what it came out to be for it, and the annualized from November to November. We're hopeful that we can maybe see a reduction or not, but we don't believe by going out that we would have any increase. We won't have any reduction off of that number either. This is what I was indicating, and maybe if you want further clarity, I can ask either Ms. Pasto or Ms. Gibbs, but it's really that's what the impact was.
Okay, so the 1.8 is what the extension is for 1 year. Is that correct?
No, we have to negotiate what that extension is, but we would think it would be in and around that number.
Okay.
Potentially.
I didn't expect it to be that high, but I understand. Okay, thank you, Chair.
Okay, thank you, Councillor Gale. Councillor Furtick.
Thanks, Mr. Chair. Through you to Mr. Harrison, how many dollars were spent or drawn from the insurance company in the last year? Do you have any? Have they given you a detailed analysis of what the region has drawn on your insurance policy?
I'm not clear as to what you're asking.
Well, the insurance obviously knows how many dollars they paid out on behalf of the region.
Oh, you're talking about claims. Okay, I can certainly turn that over to Ms. Pasto. She'll have that information.
Okay, thank you.
Through you, Chair, I can advise that in the last year, I mean, our insurance deductibles across a number of our coverages are quite high, and so our insurance company at the moment has not had to pay out any dollars under the insurance policy. So we have been paying out any claims and costs related to claims through our self-insurance program within our deductibles.
So that raises the question of how many dollars then has the region paid out in using their deductibility then if we haven't drawn any money from the insurance company? How many dollars have we spent out?
Through you, Chair, I think that can be better answered perhaps through another report that is on our agenda today in terms of providing council with a report in terms of claims that are issued against the region and what the overall costs are. So I think that might be better answered through our biannual report, but I'll turn it over perhaps to Todd to maybe add anything further to that.
No, I have nothing further to report. I think that's where it's captured.
Well, I guess that doesn't answer my question in regards to the increase. What I'm trying to do is substantiate $1 million increase in the insurance company when in fact we have not drawn any money from the insurance company, that the region has paid out all the deductibility, which tends to say to me then, why are we not going self-insured? To heck with the insurance. The numbers don't add up to me.
Well, I mean, I guess I would suggest maybe we'll go back in time. A few years ago, we increased our deductibility to self-insure, which resulted in at the time a lower premium. As I indicated, when we went to market last year, the market's hardening. This is not unique to Niagara by any stretch of the imagination. This is happening across all municipal entities, that because of the liabilities that municipalities incur, and I'll give you two examples. EMS is one area, and in transit is another area. There's been fairly large, significant payouts. City of Ottawa had a catastrophe in their transit system. The EMS item, there was a problem in Hamilton. That's impacted all of the marketplace. I could go through all the other items that have generated the premium increase. As far as our deductibility, I mean, there was an analysis that was done a couple of years ago. The deductible went up. Certainly, if you're suggesting that we should lower our deductibility or look at a different model, we certainly can look at that this year. However, we need insurance, and the best way to do that is to work with our current provider.
I can't disagree with you to some degree, Mr. Harrison, but having said that, I don't agree that maybe what we should be doing is going back and having another analysis of what we're paying out. You know, I mean, if we're paying everything out in deductibility and not using the insurance company, I'm really reluctant to say, well, we'll give you another $1 million just to extend it. So anyway, thank you, Mr. Chairman. It doesn't answer my question, and I won't support it.
I would just say that the insurance program, while it's not dealing with the things that are under the deductible, does provide comfort to the municipality if we had some catastrophic failure. And we have a number of very large assets, and I'm looking at the Commissioner of Public Works and the Director of Wastewater and Water Management. We have significant assets in those areas that if we had some sort of damage to those facilities, that's when the insurance would kick in and would support us. And that's what our premiums are paying, and that's why we're having an increase in our premiums. It's all interrelated. The other things that are below the deductible, we can certainly provide you a report at some point, another report if that's what you would like, to give a comfort level of what we're paying out in our lower deductible, or we can also provide some analysis to give committee a bit of an indication on the value of that deductible amount. But what I'm saying is that the claims themselves that are under $1 million is not what's driving the premium increase. It's the other elements of our insurance policy and our program.
Don't you think, Mr. Harrison, through the chair, that we should maybe have another look at that if it hasn't been looked at for a couple of years or 3 or 4, whatever it is down the road?
I'm going to turn that over to Donna Pasto, because again, we look at this on a regular basis, but I'll give it to Donna because Donna manages the program.
Okay.
Through the chair, I can point to our recommendation, the second, perhaps it's the third recommendation. No, I'm sorry, it's the third recommendation made in report number 22, 2021. We are looking to obtain an updated actuarial analysis of our loss exposure and risk financing. And so perhaps some of those answers will come forward, and we'll be able to, of course, share that with council at that time. But again, I just want to reiterate some of the points made by Commissioner Harrison. In terms of the increases to our premium, the several factors are driving those premiums and those costs up globally, not just for municipalities, but rather globally. And a lot of that has to do with the diminishing investment returns that insurers are seeing, as well as the climate change, our increased natural disasters that we're seeing across the world. Not to mention, we're seeing greater costs for municipalities as a result of floodings and tornadoes and fires. And so those are the reasons why the hard market and several reasons, climate change, are driving the premium costs up, not necessarily just for Niagara region, but rather globally. So I just wanted to reiterate that one more time. Thank you.
Thank you, Mr. Chair. I don't have anything further.
Thank you, Councillor Furtick. Councillor Whalen.
Thank you, Mr. Chair. Commissioner Harrison, I would imagine you can test or give some examples of what happened a few years ago when some of the lands went with their self-insurance. It was a disaster. So, and can you just confirm that this policy also includes liability, does it not?
Two questions, Mr. Chair. I'll try to answer. There was a program many years ago that was a kind of a where there was a number of municipalities that were paid. The wording is slipping my tongue right now, but it was everybody was in the same policy, and you took the risks of everybody else. And while it worked on lowering premiums for a short period of time, you also inherited all the risks of your partners, and there was some significant increases that happened. And even for those that had left the program, there were significant increases after they'd left, which is kind of like the hangover after you'd gone out 2 or 3 years. The reality of it is that some municipalities, and we are committed to taking a look. I mean, some municipalities, and like in the Waterloo region, and I know York does it, just that they have programs like this. However, we think that I'm still convinced, because of my time in the municipal sector, that taking on other people's risks because you don't really know their enterprise risk management is not the proper way, but we certainly will take a look at it. Your second question was liability. Yes, it covers liability.
So that being the case, if we had one claim for $1 million from a death by chance, that would easily pay for what our premium is. Thanks, Todd. Todd, I would imagine once you get the negotiations done, you'll come back to council, let us know just how you made out. Just the devil's advocate, I hate to see an increase like we had last year. So keep us in touch.
We'll be coming back after we complete negotiations with the next steps. So hopefully we can resolve that soon.
That's great. Thank you.
Thank you, Councillor Whalen. Councillor Height.
Yes, I'm only speaking after hearing what Councillor Furtick was suggesting about self-insurance. I have house insurance, I have car insurance. I think we all do. And obviously, we do it to protect our investments so that if there was ever a huge a fire, a bad car accident, etc., you want to make sure you have insurance. So you can go for 20, 30, 40 years and never collect from your insurance company and say, well, I've been paying all this money all these years. Obviously, it's for the exposure that we're all concerned that we have to feel that we are protected. So it's critical to have this insurance and not self-insure, I think. So those are my comments.
Thank you, Councillor Height. I see no more speakers on the list. So with that, please vote electronically. And that is carried. Thank you. Our next report is CSD 23-2021 concerning 2021 property tax policy ratios and rates. Can I ask Councillor Height to move that and Councillor Gale to second that? So it's now on the floor.
Sure.
Mr. Harrison, would you like to make any comments?
Sure. As all the council knows, tax policy is the responsibility of the upper tier municipality. So we've engaged third party to assist us with our annual tax policy and ratio setting. The local area municipalities, area treasurers were all involved in our discussions. We have complete agreement amongst all the area treasurers on the way going forward. Just to be brief, we're going with the status quo possibility and continuing with the reductions and that we've already had in the subclasses. The other thing is, just to touch on it, is that as indicated, the provincial government had provided additional levers, I guess, to change a subclass in the commercial sector. However, the regulations, as we had indicated a couple of months ago, weren't out, and it was felt by all of the area treasurers and ourselves that we wouldn't. And I think this committee had said they didn't endorse it, but there's been no change in that. So the report that you have in front of you is the status quo report. What ultimately would end up is that there'd be, for a regional taxpayer, that with the average assessment, it'd be about a $27 increase this year, year over year. So certainly we have staff here that can have more of the details, and we can certainly work through any questions that you have.
Thank you, Commissioner Harrison. Councillor Redicott.
Thank you, Chair. Just had a question about the multi-residential rate. So what does that include? What properties would be included in that particular category?
I'm going to turn that over to Helen, Director Chamberlain.
Through the chair, we have the two property classes. The new multi-res is any new construction with over 7 units, and then the old multi-res would be anything, I think it was built prior to 2013, I believe is the date, and it's again over the 7 units.
So thank you. If I might, the new construction is taxed at the same rate as residential.
Mm-hmm.
And what would be the rationale for distinguishing between new multi-res construction and old existing multi-res properties?
Well, I think the belief was to incentivize new developments in multi-res properties. So the new properties, because it's going to be at a lower ratio equivalent to the to residential, would encourage developers to go with those types of properties. That's, I believe, going back when this was initially developed, that was the reasoning. I could turn to Director Chamberlain. She's saying no. There wasn't any other things that were brought up at that time, but it's really to ensure that, as we've talked about, there's a shortage in these types of properties, and in Niagara and in Ontario, and so it was an opportunity that was felt that we could try to incentivize folks to develop in those areas.
Yeah, I agree with that, and I think it's an admirable approach and one that would help a construction of new multi-residential buildings. But the taxation on the old existing multi-residential properties does have an impact on the affordability of those units. So I'm wondering, not for this year, but just going down the road, what could we find out what the financial impact would be if the multi-residential were all treated in the same fashion in terms of tax rates?
Chair, certainly for next year when we engage in this, we could look at that. Again, as you know, Mayor, any change in the ratios of one class would impact all the other classes, and so that would be a potential concern. But we certainly can look at it next year. We have to get this approved this year, but for next year we can certainly look at what those impacts would be. As you know, we had MTAG do a lot of analysis, and we can take a look at that next year.
Yeah, that's great, and I'm going to support this, but I would like to maybe get that information relative to the multi-residential aspect sometime prior to budget, so that at least we've got that information in advance going in.
I think that's possible. Yep, that's. I see Mr. Harrison is saying taking that as direction, so he'll be bringing that forward towards our budget discussions.
Great, thank you, Chair.
Thank you, Councillor Redekop. Let's move to Councillor Campion.
Thanks, Chair. I just had a question with regards to the concept of the special small business class that's been bandied around a bit. I realize it's too late for that this year, but is that something that potentially could be considered next year?
Through Chair to Mayor Campion. Certainly we can take a look at it, Mayor. One of the biggest issues for us is that the regulations and the fundamental how that would work hasn't been provided by the province yet. You know, when we first brought this to committee, I think 2 meetings ago, we had indicated that, you know, until those regulations were out, and especially in talking with others through ORS, the area treasurers, as well as MFOA, most municipalities have not proceeded with that due to the regulations being out, but it's something that we can certainly come back to committee next year to consider. I would point out, though, that the provincial government has provided relief to the CAP classes, particularly commercial and industrial, with the reduced education rates, which afford, you know, that's a flow through to the property owners, that there's a reduction. So it's outlined in our report as well what the impact would be.
Yep, that's thank you, Chair. So through you to, that's exactly what I'm looking for is, you know, the potential that could be of assistance to small business and maybe bring a little bit more, I would say, equity into the whole system. But so that's really what I'm looking for. I realize the regulations are being put together, and I'd just like to see that on our radar for next year if all those regulations are in place and what the impacts are on today. I appreciate that, and I'll look forward to seeing that next year. Thanks.
Thank you, Councillor Campion. Councillor Easton.
Thank you, Mr. Chairman. Mr. Harrison, could you please clarify the assessment class for aggregate? I did see the note in terms of the reference to residential. I was under the impression that there were some parts of this that were industrial in nature. Could you clarify that for me?
Sorry, what are you suggesting, Mayor? I apologize. I didn't understand the question.
I noticed that there was a reference, and now I have to find it now. There was a reference regarding the aggregate. There's a reference to the aggregate class. Now I can't find it. But the reference that was made in the report goes to table number 1 and the residential class. There's a connection between that 1.7% increase and the aggregate class, if I'd read that correctly. Now I have to find it.
I'm going to turn this over to Ms. Chamberlain.
Through the chair, I don't believe in this particular report. I think maybe Mayor Easton's referring to the aggregate as in quarries. That's, I think the term may have been used in the report, but as implying the sum of an accumulation of. I don't think we referred to any analysis related to aggregate properties. I do believe they fall under the industrial class, not in the residential class, if that is where the mayor.
So the terminology, I'm sorry, could you clarify then the terminology of use of the aggregate? Are you actually talking about the mined stone when you refer to aggregate in this document?
Yeah, the aggregate in that regard would be core, but it's not in our report. But that terminology is aggregate would be landfill, not landfills, but quarries, various. There's a few in our region that we have, and they're
absolutely
in the industrial class. And they also, if my memory serves me correctly, there's been some new regulations that are being proposed in those areas, but that wouldn't be impacted. That's not impacted in this report, but there are regulations. So the aggregate is, and it would be in Lincoln. There's a property there, and there is one in Niagara Falls as well.
Mr. Chairman, I think it would be, I would like to see a more comprehensive report on that. Is it appropriate for me to ask the commissioner to provide that report sometime in the future?
Sure, we, to the chair, I can provide a report. Maybe I can reach out to you and talk offline as to
Yeah.
what you're looking for,
That would be great.
to assist me. Okay, thanks.
Thank you very much. Thank you, Mr. Chairman.
Thank you, Councillor Easton. I do not see anybody else on the list at this point in time. So with this has been duly moved and seconded, can you please vote electronically? And that is carried. We're now moving into the consent items for information. So first of all, I'm going to ask Mr. Harrison if he has any comments first on CSCC 13-2021, which is the response and business continuity and corporate services. Any commentary?
Sure, Chair, thank you very much. In the last meeting, I kind of gave a very lengthy run through of all the departments and their impacts that they've had in the last meeting. This time, I'm just going to kind of pick out a couple of the highlights. Corporate services is supporting the whole organization in so much of the managing the pandemic. That includes facilities, finance, legal, and business licensing in the Mass IMS sites. A lot of work has been done by my team to support public health in that initiative. Specifically, now getting into more specific areas, the facilities group has continued to have work on major infrastructure. You may recall, or it may have happened, I'm not sure if I announced it, but the police building on Welland Avenue in St. Catharines, District 1 has been completed, and the police have been moved in there, and the backup unit has been moved. Backup 911 has been moved successfully, and everything's operational. So that's been very well. Our IT and finance team have been stretched to support the pandemic. However, there are things that are going on, and one of the items, as you know, we had a DC background meeting kickoff. The background study is well underway, incorporating the whole entity. From the legal team, the courts is really important. They had their very first Zoom trial meeting this week, which is we're at the forefront of this, as I understand, in the province. So that's a good, a real shout out to our team and the courts unit. Just to make committee aware, the asset management requirement that was scheduled for June 2021 has been backed up to 2022. So I know all the mayors would know that as well, because the same legislation goes for the region as it does for the municipalities. And then the real estate team, procurement teams have been continuing to pump out all the essential and urgent procurements to ensure that the work that we've approved in our budgets and our contracts are out the door and operational. And then at the last thing, I would just say that our business licensing team has been stretched enormously as a support with the IMS group, but also in continuing to do their work in bylaw enforcement. And to let you know, there is a bylaw coming in June, I've referenced before, that's going to be talking about this is the cleanup with the transition from us, from Niagara Regional Police. So that's what's gone on in corporate services over the last month, and there's so much more I could report on, but I don't want to take everybody's time up talking about my terrific team.
Thank you, Commissioner Harrison. So are there any items on the list of consent items that wish to be taken separately? I see, Councillor Redekop, you have your hand up. So is there an item you wish to deal with separately?
There is. I'd like CSD 24 to be lifted from the package and dealt with separately, please.
Yes. Sorry, which one again, sir?
24.
24? Okay, thank you. And Councillor Gale, I see you wish to raise
I have
one.
a question on item CSD 21.
Okay, we'll come back to that. Councillor Diodati, did you wish to raise an issue?
Yeah, Chair, I'd like to lift CLK item 6.4, CLK 2021 double direct counselors. I'd like to speak to that.
Okay, thank you. So we will start in with item 6.3, which is CSD 24-2021, Hospice Niagara request for funding. To put it on the floor, Councillor Redekop, would you move that? And
I would.
And Councillor Yip, would you second that?
Yes, I will.
Okay. So 6.4, or sorry, 6.3, the Niagara, Hospice Niagara request for funding. Any commentary from you, Commissioner Harrison?
Sure. Thanks, Chair. So real briefly, Hospice had made a request late last year, about the same time that the request for the West Lincoln Memorial Hospital came in, for additional funding, that the $4 million that is being recommended here. This would be for all of their capital. They have an extensive capital project, and we included their presentation in there. I want to point out that currently we have an agreement with Hospice Niagara for the original project, which was at the Gilmore site, which is in conjunction with our long-term care facility. And what the arrangement with that project was, is that there was an approximate cost of approximately $6 million. The region provided land, and we're going to be providing a nominal lease for that land. And also there's some savings that, because the project is being done in conjunction with the municipality, that there is some exemptions of costs that they otherwise, the hospice would incur. So, and we, in the report, we've identified that as approximately $390,000. So I just wanted to make that point. You know, that's the history of that project. We're continuing to work at the Gilmore site with the hospice group as we're developing, as you got an update from our construction team yesterday in regards to the project. I would point out, and I appreciate Council's desire to assist, but we do not have a policy that allows this type of a grant. And secondly, I would point out that, and I just, you know, not to be the doom and gloom guy, however, while this is a fantastic organization and they do great work, this is not something that is in our core operating responsibilities. And I would really strongly suggest that everybody, as we go forward with any type of work in this area, that there are significant regional pressures on regional services that we're going to have to deal with over the next year's budget and going forward. And never mind about the impacts of the pandemic, which we really truly won't know what those will be until going forward. But definitely a great organization, certainly great work, but it's also going to perhaps bring forward more requests from other agencies.
Thank you, Commissioner Harrison. So I will turn this over to Councillor Redekop.
Thank you very much, Chair. And I appreciate old gloom and doom's concerns about the future. He and I have had a lot of discussions about this and other topics, and generally speaking, I'm pretty much aligned with his view of the world, the financial responsibilities and obligations that the region is faced with. But I do want to point out that the town of Fort Erie also has no obligation to provide funding for any of these types of facilities. And we, like other municipalities in Niagara, have done that in terms of the hospitals, which we have no legislative responsibility for. And in the property that was acquired by the region where the future Gilmore Lodge is going to be constructed, the town of Fort Erie committed $300,000 towards the acquisition of that property. Again, not in our lane, but it's like the old adage says, you can sit in the dark, sit in the corner and curse the dark, or you can light a candle. And we've done that. It was interesting to hear from the presenters of the South Niagara Hospital make reference to the importance of there being integration among healthcare services in Niagara, and made specific reference to Hospice Niagara. in terms of the services that they provide, and also again made specific reference to Hospice Niagara in terms of the collaboration required among the various healthcare service providers in Niagara. The reality is that, yes, we don't have an obligation to put money towards Hospice Niagara, but the other reality is that there are 10 beds in Niagara. The average requirement for the province is 7 to 10 beds for hospice care per 100,000 people, which would mean that in Niagara there should be anywhere between 31 and 45 hospice care beds, of which there are currently 10. This bill by Hospice Niagara in Fort Erie and Welland would increase that number to 30, 10 beds at each location. Right now, 60% of all people who are served in the hospice care beds in St. Catharines, which is where the facility is, are from South Niagara, 60%. And if the hospital, when the hospital, new South Niagara Hospital is constructed, the beds that are currently located in Fort Erie at the Douglas Memorial will be eliminated. So there'll be no beds even in South Niagara at all for hospice care in Niagara. The report does talk about home care, hospice, and in many respects, that is a service provided by Hospice Niagara. And the service itself may be funded through the government, but the need for these facilities is great, and it's going to continue to be great. So that we have to look beyond where we are. And this is, in my view, much more important than some of the other projects that the region has funded, which are outside of our lane in the past and currently have responsibility and liability for. The report talks about $4 million being 1% of the region's levy. The request isn't that this be funded over 1 year. The request is that this be funded over a 4-year period of time. And that would be fine because that would kind of fit in or align with the opening of the new South Niagara Hospital. The reality is that it's cheaper for hospice care to be provided in the facilities that are being proposed than for individuals to remain in hospital until they expire. That's very, very clear. And that's why the government ordinarily would support this. And the report makes reference to the fact that there is a program for assisting in the construction of these beds that the provincial government has. Unfortunately, the province hasn't committed to this project, these two projects. And that's probably because of their focus right now on the pandemic, as the Niagara Health presenters made reference to. So aside from all of that, the reality is that the construction of these two facilities in Welland and in Fort Erie will serve all the residents of Niagara. They will also make it easier for individuals to receive care closer to home, hospice care closer to home, and they will provide not only $3.3 million in economic growth on an annual basis through the employment and the construction, but they will provide 25 trained bilingual healthcare staff for the jobs required in Welland, and a total of about 50 to 60 new healthcare jobs across the region in Fort Erie and Welland, St. Catharines. So that, Chair, I'd like to move an amendment to this report. I've provided the wording to the clerk. And I wonder if she could put that up on the screen.
Okay. By the way, I have a question for you, Councillor Redekop. Your numbers on number of beds, does that include McNally House in Grimsby, which is also a Niagara facility?
Well, it might be, but if it's in Grimsby, it's not part of the Niagara Health setup. So that probably isn't included in these numbers. And I'd have to ask the executive director of Hospice Niagara how those fit into the plan. But certainly Grimsby is in Niagara. I concede that. But as you know, for healthcare purposes, it has been connected with Hamilton.
Yeah, it's not the job of the chair to argue. My point is that
Yeah,
it's
and wait, I
in,
can get clarification on that because I'm pretty confident that Ms. Nagy is watching today's proceedings. So the amendment, if I could just very briefly speak to the amendment, does request that council support the request for funding by Hospice Niagara, that the first increment, first installment of funding be made available in 2022 and it be spread over 4 annual installments. I picked April the 1st simply because it's at the end, it's at the beginning of the second quarter, which means the first quarter revenues that would be coming in from tax installments would be available. And also asking staff to create a program to deal with these types of requests, because they may be forthcoming in the future, but I think there are some specific criteria that we should be looking at. And those would include, whether the project is going to be integrated with other healthcare services in Niagara, the extent to which the project does serve all residents of Niagara, the impact of any proposed new services or extension of existing services through the project, and how the project will be funded, or if it's being funded also through private fundraising and other sources of revenue.
Councillor
I gotta
Redekop,
tell you, I gotta tell everyone while I'm sitting here, we have a couple of foxes in our neighborhood, and we've got one going back and forth across the front of my house, and now just going down to the river. And it's been carrying food back and forth. So I'm guessing that it's got a den someplace near my home, which is fantastic.
Yeah.
I'll take photos and pass them on.
that's a tangent, sir. Do you have a seconder for your motion?
I believe I do. I believe it's Councillor Campion.
Okay, thank you. So there's an amendment that has come in front of us now that we can deal with from Councillor Redekop. So are there any comments to the to this? And Commissioner Harrison would like to make a comment.
Yeah, so thank you. Point 3 or part 3 of the amendment, just to be clear, it's not a capital, but it doesn't go to the capital budget. This is not our asset, so it wouldn't be a capital budget amendment. It'd be an operating budget item, be treated similar to our hospital fundings. So I think that needs to be amended. The other thing is, and while I appreciate that, we can defer the contribution until next year, and we can do installments. Is there a caveat, again, because this is dependent upon the construction happening? Is there a caveat that we want to put into that amendment in regards to that only these installments would go forward if there's or if it's just agreed that we would pay equal, we can come back with how we would fund it? There's some question as to, I've had discussions with the Hospice Niagara folks, and again, over on their overall capital program, I would like to understand what the construction is looking like before we commit to when we would pay. So if you left that one with us, I would appreciate that, Mayor Redekop, if that's something that you'd be comfortable with.
Yeah, I'm agreeable to all of those. If this is not a capital project because the region doesn't own the property, that's fine. That should then be operating budget. In terms of when the installments are paid, they definitely should be tied. Yeah, actually, they should be paid, I guess, as construction proceeds. So that I think should be amended as well.
And there's multiple properties. There's multiple properties that are going on at the same time, right? Their capital ask includes not only the Gilmore site, but there's a site that's in Welland, and then I believe that there's amendments on the St. Catharines site as well. So, their ask was for us to contribute $4 million, and I would like to get more certainty as to what that looks like for a committee, if that's adequate with you. So I think maybe your suggestion number 3 could just be that it's funding to come out of the 2020 Niagara Regional operating budget to be paid in 4 equal installments, to be determined, timing to be determined with a subsequent report to Budget Committee.
That'd be fine. I'm agreeable to that. On the understanding that your main concern is that you would want to know that the projects are proceeding, and that in fact there's a need for the funding.
Yeah, I'm not challenging the rights of committee you've made the grant. It's just the timing on how that would be like a process to pay them. I wouldn't want to advance money when the project's not started or as such, right?
Yeah, I fully agree with that, and I appreciate your highlighting that for me. I didn't formulate this. I should tell members of staff or members of council that you and I spoke about this yesterday. I hadn't really determined what direction I was going to be heading on this until this morning. And I appreciate your comments, Commissioner Harrison.
Yep, no problem. Thank you.
You're going to put up the, okay. So Anne Marie's going to put up the motion as amended, just to make sure you're okay with it, Councillor Redicott, before we move away from you.
Yes, and Chair, I can advise you that there are 6 beds in Grimsby. They weren't included in the 30 that would be created if these 2 projects in Welland and Fort Erie proceed along with the existing 10. And that's primarily because a lot of those beds are integrated with the Hamilton Health Services.
Okay, so take a look at the motion. Please read it and make sure you're okay with that.
Yeah, I'm agreeable to that wording.
Okay, Councillor Campion, you were the seconder. You okay with this?
Yeah, yes, I am. I'd like to speak to it when the opportunity arises, please.
Yep, no problem. You're on the list. Councillor Easton.
Thank you very much, Mr. Chairman. I believe it is obviously very appropriate for Mr. Harrison to caution us, and he has certainly done that. The direction that we're moving on a piece-by-piece basis, and maybe that's part of the issue, is that we have recognized, because of past decisions within the communities of Niagara, that the region does have a role to play in the overall involvement of protecting the health and well-being and the equity of health in all of our communities. And our communities are not well served where there is not an overall system in place, and that's a system that looks at birth to death. And so this is part of that. And it is appropriate, I believe, for this to come forward at this time in order to make those points. The region cares about health and well-being. We're going to begin to invest in that so that we can have a say. There are plenty of people milling around that are going to be, that already have provincial sanctions or provincial approvals to make decisions about local care. If we can expect to have any influence in our communities, we're going to really have to keep our eyes on what's going on. And so that's why the presentation this morning was so refreshing, because it comes as a comprehensive plan and it takes into account the importance of discussing care needs and care delivery in every community. So our actions go a long way to send that message about a fully integrated care model up and down. I can't see another area of core business that's more important than the health of our community. If we've learned nothing else, we are at great risk, as every community in the provinces in Canada. We are at great risk if we don't take more interest in this and get involved so that we can influence to a greater extent. So I believe with Mr. Harrison's advice and cautions, that our actions illustrate a strong desire to include and influence future decisions about healthcare delivery and the importance of a complete system. And if that change can only be made piece by piece at the moment, then the expected standard, I think, is becoming more clear. And it would appear that, that with the decisions that have been made thus far, and I certainly hope that this will pass, that we are sending a message about what it is that we intend to influence related to healthcare. It may be unpalatable, it may be a major concern in terms of the financing of it, But I think that it is the right move that we need to go. And if we don't take this on and become very clear about what our core business is in relation to health, then I think we're really missing an opportunity. Thank you, Mr. Chair.
Thank you, Councillor Easton. Councillor Campion.
Well, thank you. And following up on Councillor Redikoff and Easton, they've more than adequately explained the reasoning behind this and the need for it, so I won't reiterate that. I can throw out those notes, but I did want to point to the fact, and it's been, I think, well described by Councillor Easton, is, you know, we can look at it and say, well, that's not our responsibility. It's not part of our core business. I think if you, history lesson, the NHS many, many years ago was going through a transitional period. And going back 10 or more years ago, where they were going to be shutting down all the hospitals and building one hospital, and then they were going to, do a variety of other things. And so probably about 10 to 12 years ago, I, as a counselor, raised the point that, well, we need to get involved in these decisions that are being made by the NHS. And as Councillor Diodati has said, the NHS has come, miles and miles from where they were before. So we see that when I brought that up at our council in the city of Welland, had great opposition from the council of the day and the mayor of the day, because they kept saying it's not our responsibility, it's the NHS responsibility, it's out of our hands, it's a provincial issue, et cetera, et cetera, et cetera. But, we didn't let that drop. And so Mayor Diodati, Redikoff, all of the municipalities have looked at it and said, no, it is our responsibility. We have a responsibility to the residents that we represent to ensure that they have a proper health care and the continuum of care that we require. So I really disagree with the fact that it is our core business. Our core business is to ensure that our residents across the region and in the lower area municipalities, it's our responsibility to make sure that they're well taken care of in the health system. So this is something that we need to do. We should have something in place. So I believe that, we need to put that process in place so that we can deal with these issues. I can remember back in the day when I did bring this up, one of our local newspapers had a, roses and thorns kind of thing from the publishers or whoever was writing these things. And, rose if you did something good and thorns if you did something bad. I got a thorn for sticking my nose into healthcare when it wasn't our responsibility. But we wouldn't be in the position we're at right now. We wouldn't have a new hospital being built in Niagara Falls. We wouldn't have the NHS, consulting with Port Colborne and Fort Erie. Wouldn't have a hospital facility in Welland if we didn't stick our noses in that. So it is our responsibility. I would urge the rest of the committee to please support this, because it's important for the care of our residents. It's for the entire region, and it is our responsibility. Thank you.
Thank you, Councillor Campion. Councillor Diodati.
Sorry, Chair, having a struggle here with my iPad. So I want to be clear that I think there's a need for this, and I think there's a benefit for this. And I think it goes into the list of things that we're trying to take care of. I mean, today we're talking about health with our hospitals. We're talking about keeping people healthy and healing them. We talk about homelessness. We've talked a lot during the pandemic about the senior centers and how underfunded they are and the poor state of them. And I know that's a big role of the province, but again, we can't abdicate our role as a region because we run our own beds and whatnot. So I think the discussion is important. I'm not prepared to support this motion at this point. It makes a commitment. I'm not prepared to make a commitment at this point. I need to know the formula. I need to have a better understanding of the commitment. And I feel that we need more of a fulsome approach to this. I'm not comfortable with the way this has been brought up and amended at the last minute. I'm very uncomfortable with it. So at this stage, I'm not prepared to make the commitment. I do see the importance of it. I do support the idea and recognize the benefit and the need of it, but I don't like the way this was approached today, brought in at the 11th hour and thrown in front of us without time to really truly reflect and have more fulsome discussion with staff and plan with their funding. We don't even know how we're going to fund our NHS things yet. We haven't even come to a conclusion on that, and we're already committing to more funds. And I just don't think this is the way to go about it. So those are my comments. Thank you, Chair.
Thank you, Councillor Diodati. Councillor Butters.
Thank you, Chair Foster. I actually concur with my colleagues who support this funding request for Hospice Niagara. I think it's appropriate. I think it's necessary. And I think that to do otherwise is very short-sighted and really abdicating our responsibility to all of Niagara, but particularly to those south of Highway 20, because we need access and equity here as well. So as much as this covers for all of Niagara, I really think that, you know, it's specific, certainly specific to those of us at this end of the region, and it's necessary and it's needed. I can tell you that when my uncle was very sick in the Collingwood area and ended up going from the hospital into a hospice there, it was really important for him to be close to a family. When you have somebody who's dying far away, it's a tough go for that person, and it's a tough go for the family. So this is something that I can support without any hesitation whatsoever. Thank you, Chair.
Thank you, Councillor Butters. Councillor Yip.
Thank you. Through you, Chair. I'd like to move to refer this, given the number of times that some of my colleagues have commented that it's difficult to have all the information when a motion is presented to us in this manner. So I'd like to move to refer to the July Corporate Services meeting, please.
It's moved by Councillor Yip. Do I have a seconder for that? Councillor Diodati. There's no discussion on referral. So at this point in time, can you please vote electronically? Yes or no? That is carried. So this has been referred. Thank you very much. So question to the clerk at this point in time, because that secondary part of that motion, does that mean the entire motion goes to the July meeting at this point?
Through you, Chair, I would suggest yes, based on the fact that the original motion was just to receive the request for information. Okay,
thank you very much. Let us move on to the next item that we have on our list, which is 6.4, and Councillor Diodati, you wish to speak to this. Oh, first of all, Councillor Diodati, I'm assuming you're going to move this, and Councillor Whalen is going to second, if you're okay with that, Councillor Whalen. Go ahead, Councillor Diodati.
Thank you, Chair, but I'm not going to move for it to be received. I'm going to be move for this to be accepted and endorsed by the region. And I'd like to speak to this briefly, Chair.
So you wish to have the motion modified at this point?
Yes.
Let's start with that.
Yeah.
Madam Clerk?
I'd move that the region support the City of Niagara Falls request to allow double direct councillor election for the 2022 municipal election.
Okay, so that's a secondary part then to this motion, correct?
Yes, it would be.
Okay, thank you. Do you have a seconder for that? Councillor Gale is going to second that. Okay. So go ahead, Councillor Diodati, and then we'll make sure that the motion gets up before you're done.
Okay, thank you very much, Chair. So this isn't our first go around with this. I know the city of St. Catharines was here approximately 4 years ago with the same thing. And this regional council did in fact support the idea of double direct or dual duty or dual role or whatever you want to call it. And the idea is simply this, that the members of regional council for that municipality serve in dual roles, both as city councilors and as regional councilors. And the advantage for anybody that's a mayor or has been a mayor, you understand that you're very much up and tuned up on everything that's going on regionally and municipally. So it's a matter of the right and the left hand communicating. And it definitely gives you an advantage in the matters to deal with your municipality. So our council has sent a unanimous resolution requesting that the city of Niagara Falls be afforded that same opportunity to pursue double direct. The premier recently had looked at governance reform in Niagara. Niagara was one of the few areas in the province that were not affected by the last modernization or amalgamation. It happened all over. It happened in London, Hamilton, Toronto, Ottawa. It just didn't happen in Niagara for whatever reason. That was before my political time. But Niagara Falls would be willing to act as a pilot for this. And as I mentioned earlier, the city of St. Catharines was supported by the region. They were supported by the majority of the municipalities around the region. Unfortunately, when it came back to the municipality, one of the votes had changed and it had lost by 1 vote. So this is being done, all, as you'll see from the report, it's being done in other areas of the province very successfully. And we do believe that if we don't make some attempts at governance reform, eventually it's going to come down and be forced upon us. So rather than wait for that to happen, we're happy to be the pilot on this. We're happy to try to move this forward throughout the region. And obviously we'll look at the results and see how it plays out. So those are my comments, Mr. Chair.
Thank you, Councillor Diodati. Oh, by the way, just as a correction, and Councillor Edgar corrected me, that was a deferral of that earlier motion, not a referral. I do apologize for the wordology on the thing. Wordology? And anyway, Councillor Redekop, you're up next.
Yeah, I just wanted to say that I appreciate the way this was dumped on us at the last minute. Look, the problem that I have with this motion really isn't the City of Niagara Falls should be able to do whatever they want to do. That's fine with me. But I happen to sit, as do all the mayors, on both the local council as well as regional council. I happen to understand what the workload is that we have. And I suppose that the double direct has always been a curious animal to me, because what it does is it puts more individuals in a similar position with a heavy workload. And I'm not sure that that is the key to better government. I'm also confident that fewer elected representatives is not the key to better government either. So those are the caveats that I have with respect to this.
Thank you, Councillor Redekop. There's no more speakers on the list, so I'm going to call the vote on the amendment that is in front of us at this point. So please vote electronically. Oh, Councillor Butters, you jumped in. Here we go. Go ahead.
Want to put your hand up? Yeah.
Thank you, Chair Foster. My concern with this is
Want your hand down then?
is the fact that I think that it could make things more parochial than they already are. I think the jobs of mayors wearing the 2 hats has got to be a really tough one, and I can only imagine the workload on the mayors in terms of the municipality that they are elected to, as well as sitting on regional council. To my thought process, having been a city councillor, how does one, take off one hat, get the other hat on, look at things from a regional perspective, where, maybe a week later you're sitting in your council chambers and trying to make the best decisions for your city. So my concern is that there would be that carryover into the regional chamber where we're tasked to look at things in a regional sense. And for mayors that have to wear two hats already, and I think that's a tough job, at least when we have separate regional councillors elected, I would hope that as much as we all want the best for our particular municipalities, we also are able to look at things in the broad sense of the work at the region. So for that reason, I cannot support this. Thank you.
Thank you, Councillor Butters. Councillor Height.
Yes, some similar comments of the last two speakers. I was not supportive of the move for St. Catharines with the triple majority still needed, regardless of what we do today. It takes away an opportunity for people who are have other full-time jobs participating at the region. I think that could create a little bit of a problem. It does create full-time politicians. I've always felt that I try to represent the population without considering myself a politician. I can be very independent, and I feel that's been important in my years as a councillor. There's an additional cost to the municipalities. There's no question about that. More staff costs, offices that are required either in the city of Niagara Falls or at the region. And if we're talking about governance, let's truly do something that is meaningful. And I don't believe dual direct is considered or should be considered real governance reform. And I can look at Chair Bradley and when he was in Toronto, and we'd always discuss, I'd say one Niagara, and he would tell me that I was nuts. And he smiles because I think he still thinks I'm crazy. But that is truly dealing with a governance issue down in Niagara. Dual direct does not do that. It also can create a problem at the municipality where there'll be different levels of expertise, not necessarily expertise, but the feeling of who's more important at the city council, whether it be the dual direct council or not, but that would be more of a city issue, not a regional issue. So for some of those reasons, I'm opposed to this. I know it will need triple majority, and obviously, and the councillor brought up the region was in favor of this. I'm going to have to go back to my old notes if I can find them. I don't recall that regional government was in favor. We're in favor of allowing the process to proceed, but I don't think we voted for dual direct at the region in the past council. Those are my comments.
Thank you, Councillor Height. We have a guest speaker, Councillor Sendzik. Go ahead, Councillor Sendzik.
I appreciate, unless there's a corporate services committee member that wishes to speak first, I think I have to speak at the end of the list. So,
oh. Well, I'll let you go first, and then we'll go from there because you were at the time. So go ahead.
Yeah, no, I appreciate that, and it is. I guess I will just. It's interesting to hear some of the comments, and I base a lot of my perspective on this request by having looked at other jurisdictions that have embarked on this. And so it's unfortunate for folks to talk about it not working here when we've got good models just down the highway, that between Burlington and Mississauga and Oakville, you got great examples of it working. And so I guess it's through the chair. It's hard to hear that and then not have those same councillors who may have been on council for 20 plus years look at those models and say, why does it work? Instead of always saying, no, this can't happen here in Niagara. I think, if Niagara Falls can do this as a pilot, why wouldn't we at least allow them to do that and take a look at what is it that'll work and not work? It's not about increasing costs. If COVID hasn't taught us anything, this whole thinking that the boogeyman of that it needs office space within the region or office space within in the city of Niagara Falls. The home office is going to be the future for a lot of this stuff. So do you have to have committee rooms? Yeah, you got to be able to go for committee meetings. But other than that, I think anybody who's working in this kind of position can actually be not requiring the additional staff. And so I think we just peel away the boogeymen of a lot of this discussion and focus on, is this something that we can explore as a means to address what has been a challenge for many, many years in Niagara. I'm telling you right now that the amount of people that think we're overgoverned is significant. And if there's ways and means that we can show that there's a modernization, or at least trying to look at different ways to do this, I think it's incumbent upon us. And this is a model. I think Niagara Falls, if they can pursue this, it's a unanimous decision at the city of Niagara Falls. Allow them to pursue it, and then let's revisit this in 2026 and see if there's other municipalities that would like to go down this road. But simply shutting the door, I think, does a disservice to what is the evolution of governance look like. Because if you're simply going to shut the door, you're saying that the system that we have today is perfect. And anyone who thinks that the system today is perfect needs to really just look around at how our communities have been built over the last 30 years in Niagara. And you can see a lot of the disconnect that has happened. And maybe this will be a way that we can look at, maybe that connectivity can actually be greater through this process. And if it works, others pursue it. If it doesn't work, well, others will continue to be in the position that they think is the best. But I think we're doing a disservice to our communities if we don't allow this to at least go as a pilot. That's my final comment. Thank you, Chair.
Thank you, Councillor Sendzik. Councillor Yip.
Thank you. Through you, Chair. I would like to just first remind committee that in July of last year, this committee, save for myself and one other councillor, completely shut down any discussion about governance reform that would have addressed a number of issues, including double direct councillors. The councillor who brought this, in fact, spoke very strongly against that motion. The other issue with this is that in a time when the wider communities have been talking for a couple of years now about the need for diversity on council. And when I'm talking about diversity, I'm not talking about how many people run. That's not diversity. We're talking about gender. We're talking about BIPOC individuals. We're talking about QS LGBTQIA+ individuals. We're talking about individuals who are of varying socioeconomic statuses. Something like a double direct model does not lend to having more diverse opportunities for who it is that we are electing to these positions. So I will be voting against this.
Thank you, Councillor Yip. Councillor Whalen.
Thank you, Mr. Chair. I agree with Councillor Hyde about this possibly bringing a full-time councillor in both positions. And then we look at the person that somebody qualified is doing it on a part-time basis now. They're going to want to give up their full-time job with the possibility of not getting reelected in 4 years. It's going to put a lot of people out of the equation, and where we got a person now that's in there for the right reason. And if you talk to some of the smaller lands, I think even the larger lands, that the regional councillors have the input in it. I know myself and a few other councillors go to regular meetings with the lower municipalities, so we know what's going on at the lower level. So unfortunately, I cannot back this either. Thank you.
Thank you, Councillor Whalen. Councillor Gale.
Thank you, Chair. I support this. The province supported this when our chair was a former MPP on it. I agree with everything that Councillor Sendzik said on it. It's a model that Niagara Falls voted unanimously on it, and it reforms our councils. We have to do something to reform our councils. As Councillor Sendzik said, too many people are speaking out of too many politicians, too many this. What we're doing now is not perfect. It's not even close to it. So I'll be supporting this. Thank you.
Councillor Furtick.
Thanks, Mr. Chair. I fully support this, and the reason I do, a couple of points. I noticed that in the last couple of years, our council has gone into closed sessions, and in some of those closed sessions, of course, they haven't got the background or don't have all of the information in dealing with the issues. I think it's important for the regional councillors to be alongside of the mayor and supporting him. Look what's happened to our municipality. This hasn't been a ride that has been very darn good this term, I can tell you that. And I really feel sorry for somebody like the mayor that doesn't have the support of some people that have a little bit of history that helps him along with governance. And it's really about governance. And he doesn't have time to turn around and tell me every day what's happening in the municipality. If you want me to go fight for Grimsby and go to the region to support Grimsby issues, I have to know what's going on. So Mayor Diodati and particularly Mayor Sendzik, yes, this has worked in other places. Region has to get their head out of the sands and look at some sort of re-governances of what's happening within our region. I would hate to see Mr. Premier to turn around, Mr. Ford, and say, well, guess what, guys, you're not 13, and you're not 30 of you, you're now 15. Well, we have to look for things that are better for our region, and we have to do it now. Other than that, through you, Mr. Chair, I fully support this because I do think that in the smaller communities, we need to have that teamwork that helps the mayors go to the regions. I mean, their schedules are doubled up the way they are. So I believe it's a good thing, and I will support this. Thank you, Mr. Chair.
Thank you, Councillor Furtick. Councillor Rigby.
Thank you, Mr. Chair. And it just as a matter of procedure here, there's really two parts of this. And is the second part being treated as an amendment at this point? So we're going to vote on that item first.
So currently,
so that's the discussion we're having right now.
Currently in front of us is the amendment that is in front of us. That is correct.
Okay. So on the amendment, I don't agree with that because it does have triple majority effects that should go in place before staff start to initiate the process to elect, etc. So while I might support the request that the city of Niagara Falls had asked for originally, I may agree to that, but I would not agree to the second part, which is the amendment, so I'll vote opposed to it. Thank you.
Thank you, Councillor Rigby. Chair Bradley.
Thank you very much. I was intrigued by the comment of Councillor Redekop about matters being brought at the last minute to committee. The previous case, it was turned down because of that and referred or deferred, whatever Councillor Edgar says. In this case, the recommendation was receipt by council, and now we're seeing that we're going to deal with this today, which is, you know, any members certainly allowed to do that. One of the things I look at is you would have one municipality which would have a different status than other municipalities. In other words, Niagara Falls in this case would have members who would serve both on local council and regional council. They would have a different status than members from other communities across the region. I think Councillor Height and Councillor Butters also made some pretty compelling arguments along with, I think, the former mayor of St. Catharines who just spoke and made a significant argument, I think, indicated his position. What it will do is it will mean that you have full-time councillors. people who don't have who are attracted to being a full-time counselor will certainly want this particular item to pass. And I think, again, Councillor Yip made the point about the number of people who are eligible, who are probably likely to be elected to councils, and the impact this would have on the diversities that we have there. There's no question if a councillor is both a regional and a city councillor, I'd be extremely surprised if they didn't need personal staff to be able to staff them. It makes sense for them to ask for that, and probably they would be reasonable in making that particular reference. Also, Councillor Butters made the case about members who serve on regional council. The concept when regional council was set up was that it wouldn't be parochial, that the members who are on regional council would think of the region. Yes, they have a background in their own communities, and that's going to be always on their mind, but they would think strictly regionally. And in this case, they would be on both. So I look at this, in a way that, again, I hadn't anticipated this was going to come forward today, because the recommendation was for receiving and I guess further consideration. And so there it is before us now. But I think to have one municipality out of all the municipalities that have a different status is difficult. And, I think, again, Councillor Height made the point about, citizen representatives. And that's what councillors are at the present time, as opposed to being like a federal or provincial member of parliament who is full-time. So it's an interesting concept, and I appreciate the fact that that Mayor Diodati brings this forth. He's entitled to do so, and he's representing his council, and he's entitled to do it. There are some great concerns about it coming forward now, but and what Councillor Rigby has had to say, but also the fact that it would give different status to representatives from one community as compared to another. Thank you.
Thank you, Chair Bradley. I see Councillor Diodati wishes to speak again.
Yeah, thanks, Chair. So I just through you, I did not understand Councillor Rigby's comment, and I thought we could just get clarification, because I didn't understand. Maybe you could clarify it for me?
Councillor Rigby, did you?
Well, if I may, through you, your amendment that you put forward is directing our own staff to initiate the process to elect by double direct method 3 members of Niagara Falls, where we still have triple majority has to approve that action ahead of time. And so it might be in the future to do that, but we need the triple majority.
Okay, so then I understand. So it should say to allow the process, not to initiate it, because I understand the discrepancy. So, Chair, through you to the clerk, maybe we can change that from initiate to allow the process, because it wouldn't initiate with the region. It would initiate the way it did a few years ago, where St. Catharines had some of its city and regional councillors going to each of the different councils to pitch the idea and answer the questions on it. So maybe we can change that word in the motion.
I'm going to turn this to Anne Marie just for a comment.
Thank you, Chair. Through you. The region needs to initiate the process. So we need to go out and give notice of our intention to pass a bylaw to change the composition of our council. So to Councillor Rigby's point, it's a region process. We need to start it, and the wording to initiate the process will mean we're going to come back with a report giving notice of our intent to pass a bylaw. We need to hold a public meeting. The process is all those steps. and that's why it was included in your amendment.
So is that how it was handled last time through you, Chair?
Through the chair, yes, that's correct. That's the process under the Municipal Act.
I see. Okay. So I appreciate that. And through you, Chair, I would just, couple of things. Number one, I know it was mentioned about this being dumped on at the last minute, but in fairness, the motion of the City of Niagara Falls has never changed. It's still in the report. So nothing was dumped. It's been there since the beginning. And I'm simply bringing that forward. Firstly, a unanimous resolution of a local council, one of the local area municipal councils. I heard discussions of additional costs. And I think Mayor Sendzik alluded to the fact that with what's happened with COVID, it's a double-edged sword. The benefit is, and if you have been following the papers, a lot of major corporations, banks, insurance companies, et cetera, will be working from home offices going forward and permanently. So that I don't think is a major factor. This comes down to better government and better governance. And I know myself, and I'm any fellow mayor that would disagree, I'd be surprised. An extra set of eyes looking at the same things that you are, I think is a good thing. And I know, and I appreciate some have said and some believe more politicians are the solution to any problem. I've never heard anyone ever say that other than a politician. We have 126 municipal politicians in Niagara. We have a lot. And all the city of Niagara Falls is asking for is a chance to be the pilot. This does not affect the rest of the municipalities. And my suggestion to you, because myself, along with many others, were part of the governance discussion with the province. And they recognize that we have a lot of politicians here. And they recognize the fact that maybe we don't have the best model. So most areas have gone to single tier. We haven't. And arguably it works. Does it work well? I don't know. But we're looking at trying something to see if it can work. This doesn't affect the rest of the municipalities if we're able to get this passed. So I don't understand why anyone would be reticent or concerned about the city of Niagara Falls trying this. It was an idea many people accepted a few years ago. It didn't quite get through. And I think if we don't come up with some solutions, we're going to get some solutions forced on us. So I'm going to ask for a recorded vote, Chair, and I'm going to ask that you respect the city of Niagara Falls request to do what we'd like to do within our own elected officials. This doesn't affect the rest of you. Thank you, Chair.
Okay, thank you, Councillor Diodati. So we're kind of getting into circular discussion here now. I saw Councillor Rigby wanted to say something just briefly.
I wanted a clarification on through you to our clerk, if I may. Is just so is it now determined that staff be directed to initiate the process? That means that we initiate the process to have double direct election or a vote?
Through you, Chair, the next step would be that we're going to come back with another report giving our notice of our intention to pass a bylaw on that.
Okay, and so this wording indicates that to you?
Correct.
Okay, then I'm fine. Thank you.
Thank you, Councillor Rigby. Councillor Whalen, do you have anything to add?
Yeah, thank you, Mr. Chair. I was wondering if I can ask Councillor Diodati one quick question, if you don't mind.
Okay, sure.
Councillor Diodati, were your intentions of cutting down your council size to go along with these full-time positions or no?
So it would in fact mean there'd be 3 less municipal politicians within the city of Niagara Falls, because the 3 regional, if this were to pass, and folks, this is a long way to go. We got to go to all 12 municipalities. We need a triple majority, and it's a long way to go. But what it would mean is that in the case of Niagara Falls, we have 3 regional councillors. So since those 3 would be double duty or double direct, we wouldn't need those 3 at both places. 3 would serve at both, which would mean a net reduction of 3 politicians in the city for the city of Niagara Falls.
Okay, appreciate it. Thank you.
Okay, thank you. Councillor Edgar.
Call the question, Chair.
Thank you, Councillor Edgar. So we are now voting on the amendment that has been put onto the table, and a request for a recorded vote has been done. So I'm turning it to the clerk.
Thank you, Chair. Chair Bradley.
No.
Say it again.
I'm sorry, can you repeat that?
No.
Thank you. Councillor Butters.
No.
Councillor Campion.
No.
Councillor Diodati.
Yes.
Councillor Easton.
No.
Councillor Edgar.
No.
Councillor Furtick.
Yes.
Councillor Gale.
Yes.
Councillor Height.
No.
Councillor Yip.
No.
Councillor Redicott.
No.
Councillor Rigby.
No.
Councillor Whalen.
No.
Chair Foster.
No.
The amendment is defeated.
So the amendment that was in front of us is defeated. So we're left with the motion to receive this information from the City of Niagara Falls. Are there any questions on this motion at this point? Seeing none, can we please vote electronically? Thank you, that is carried. Okay, we've gone through the two items that were wished to be raised. So,
No, Chair,
yeah.
I brought up one on the development charges.
Oh, I'm really sorry, Councillor Gale. Sorry about that.
Not a problem.
So do you want to just ask a question, or do you wish
I
to
just
raise
have a question to ask.
Okay.
It should be short.
Okay,
My
that'd be great.
question-
Thank you.
May I ask it now?
Yes, please go ahead.
Okay. So my question to staff is there any legal proceedings on development charges? And if there is, why are they not shown on the report?
So, Chair, this statement is really an annual statement that's required of the treasurer to put in front of council to identify the collection and uses of development charges. And so that's the reason for the report. The litigation that you are referring to by the Niagara Home Builders Association would have no bearing on this report. It is actually something that I think we're going to be discussing in a later report, but it has no bearing on this report because this is more a formality of the province that we have to report back to council, so council is aware of what's in the reserve balances and what's committed and et cetera, like that.
Okay, thank you for that. I thought it would have a reflection on the reserves and that, but I'll hold my questions for confidential. Thank you.
Thank you, Councillor Gale. We have 6.1, 6.2, and 6.5 now to be grouped together. I'd like to ask Councillor Height to move that and Councillor Yip to second that. Are there any questions or commentary yet on any of these three reports? Seeing none, please vote electronically. And that is carried. Moving to our next section, which is other business. Are there any items of other business this morning or almost afternoon? Councillor Whalen.
Thank you, Mr. Chair. Quick question to Commissioner Harrison. We haven't had a report on the Canada Games for a while. Can you tell us when we might be expecting an update, a situation, how we stand?
So through the chair to Councillor Whalen, we anticipate that we will be coming with a report on an update on the transition and all things Canada Summer Games in Committee of the Whole in this May.
Appreciate it. Thank you.
Thank you. Any other business? Oh, Councillor Butters, go ahead.
Thank you, Chair Foster. I just was wondering if the motion to vacate a councillor's seat is coming forward to corporate services in May.
You're referring to the concerning, yeah. Sorry, we're all tongue-tied right at the moment, Barb. So, yeah, it's the motion concerning the discussions going on about code of conducts and integrity commissioners, correct?
Yes, and asking the province to come up with a mechanism on how a seat could be vacated.
Yep, absolutely, and that is coming forward to the May meeting, and the timing is appropriate because the province is opening up for commentary back in and through from municipalities. So it is a good time for us to be discussing it at that point.
So it'll come to Corporate Services Standing Committee in May then?
Yes, it is.
Okay, thank you.
Thank you, Councillor Butters. Councillor Yip.
Thank you, through you, Chair. More than a year ago, January of 2020, actually, I brought a motion and Councillor Edgar seconded it for a thorough review of all policies related to ride sharing and vehicles for hire. Hopefully somebody recalls that. The motion passed. It was supposed to come to the April 2020 meeting. It didn't. I was told it would come to the September 2020 meeting. It didn't. I've asked again twice since then. I was told most recently that it would come back to this meeting. It didn't. I'm curious when we can expect that.
Thank you. I'm going to turn it to Commissioner Harrison.
So to your to the councillor, yes, as I understand it, that this has been delayed, and it's been delayed for no other reason than the business licensing folks and our legal team that's been working on that have been engaged fully. We anticipate that the report. I'd have to get back to you, councillor. Yeah, okay. So I'm being told now that my original comment was, and I believe I mentioned that in the overview of corporate services accomplishments and outstanding items, that it would be coming back as part of the June bylaw that Angelo has been working on. So apologize that this has taken so long, but that bylaw is we needed the legal support, and unfortunately the lawyer that was working on it has left for a job in end of January. So
thank you. I did hear your comment about the bylaw. I just wanted to be clear that this was actually included in it because there had been discussion about that in the past. So I will put it in my notes for June. Thank you.
Yeah, and we'll make sure it is definitely coming, because I know that Councillor Redekop has asked as well. So this is planning. We have the staff in place, and we're going to be ready for the June meeting.
Thank you, Councillor Yip. Any other business? Seeing none, we are going to be going into closed session, and I do know that there's a request to deal with the one item for sure. Is there a request? There's a second item under closed session regarding a proposed acquisition. Does that wish to be speak to as well? I don't see anyone wanting to talk about that. So that being the case, we are going to go into closed session. Before I ask for a mover and seconder to go into closed session, I would like to remind you of your obligations respecting closed session. Those who are participating electronically in the closed session must ensure that no other person is in the location from which they are taking part in the meeting, or make appropriate arrangements so that any other persons cannot see or hear any of the confidential deliberations taking place. If this is not possible, you must withdraw from the meeting until it has been reconvened in open session. So at this point, I'm going to ask for a mover and seconder to go into closed session. Councillor Gale, would you like to move that? And Councillor Whalen, would you like to second that? Please vote electronically, yes or no. And it is carried, and we are going into closed session. So we have to deal with a few things here, and then we will start. We're good to go. So we have two items of business arising from the closed session. So the first is confidential CSD 25-2021, a matter respecting a proposed acquisition of land by the municipality seniors community programs lease agreement in St. Catharines. Councillor Rigby, would you please move that? And Councillor Gale, would you please second that? Duly moved and seconded. Any questions to the motion? All those in favor, please vote electronically, either for or against, please. And that is carried. Second is confidential CSCC 12-2021, a matter of advice that is subject to solicitor-client privilege and respecting litigation. Response to Councillor Gale's motion regarding litigation matters reported in confidential CSD 60-2020. Councillor Gale, I'll have you move that. Councillor Easton, would you please second that? Any questions to the motion? All those in favor, please vote electronically. Okay, that is carried. Okay, thank you very much, everybody, for this meeting. Our next meeting is going to be held Wednesday, May the 12th, 2021 at 9:30 a.m. Have a good day.